FODAC was founded in 1986 to provide home medical equipment such as wheelchairs, walkers, hospital beds, and shower benches to those in need. Many FODAC clients find themselves underinsured or not insured at all. We help them fill the financial gap to obtain equipment that supports a more independent and quality lifestyle. We reach out to individuals and businesses for donations of new and gently used equipment that we refurbish and provide to clients at little or no cost. FODAC helps those with mobility impairments lead more independent lives by supplying them with the necessary tools and services. Wheelchairs and power chairs improve home mobility, but they also provide easier access to work, school, and community resources, such as restaurants or grocery stores. Home modifications open access to kitchens, bedrooms, and bathrooms so the client regains their dignity and independence. We work with personal and business resources to secure sponsorships as well as donations of new and used home medical equipment. We develop and maintain an effective supply pipeline from vendors, manufacturers, and facilities like hospitals and assisted living centers. FODAC is one of the largest organizations to supply home medical equipment on a national scale. We help the victims of Hurricanes Katrina, Ike, Isaac, and Sandy. We also sent home medical supplies to Joplin, Missouri, and Moore, Oklahoma after devastating tornadoes left thousands homeless. Our model of reuse keeps used home medical equipment out of landfills and puts it in the hands of those in need. Our partnerships with corporate sponsors, foundations, and individuals support our mission. For every dollar donated to FODAC, we provide $10 worth of equipment and services to the disabled community. For every dollar donated to FODAC, we provide $10 worth of equipment and services to persons with disabilities. We operate a 65,000 square foot facility in Metro Atlanta, which includes 40,000 square feet of warehouse. This allows us to collect and inventory large amounts of home medical equipment and supplies so that we're always ready to address the needs of the community or answer a call for disaster relief. Our strategic partnerships with a number of trucking companies allow us to easily and cost-effectively collect and deliver donated equipment from numerous sites across the Southeast. FODAC conducts client satisfaction surveys after each request fulfillment. Because of our assistance in improving their mobility, 85% of FODAC clients are able to access health care, 22% are able to resume school, and 17% maintain employment. Historically, 65% of our clients are considered indigent, and 35% are low to moderate income. 90% have stated that without our support, they would not have been able to purchase or secure the equipment necessary to maintain their independence and quality of life. Many people incorrectly assume that medical insurance or government programs like Medicare and Medicaid cover the costs of home medical equipment. But government cutbacks and reduced healthcare coverage have created a gap in resources for those with mobility impairment. Many are falling through the cracks of the healthcare system. They simply have no insurance or funds to pay for home medical equipment, or they're waiting for many months for Medicare or Medicaid to step in. Also, because we operate an on-site thrift store, people assume they can buy medical equipment from us. Actually, the thrift store is a fundraiser selling clothes and household goods with proceeds going to offset operational costs. FODAC has provided assistance in 46 states and 65 countries, including donations of 7,000 hospital beds, 30,000 wheelchairs, and hundreds of thousands of other medical items and supplies. We've been recognized by the Rehabilitation, Engineering, and Assistive Technology Society of America for our unique business model as a best practice that should be replicated across the country. We've also been selected by the Georgia Emergency Management Agency as the official organization tasked with housing, distribution, and management of disability shelter kits for all of Georgia to support those with physical disabilities or affected by a disaster. We've raised the capital to completely renovate our corporate facility, yet challenges remain in our annual operational budget. We're working to eliminate our facility mortgage debt of about $1 million. Once paid, more money could go towards our mission of providing home medical equipment to the disabled with little or no cost to the recipients. With additional resources, we could complete the renovations and repairs to our facility. We could provide security and integrity to the building, as well as open up space for equipment and supplies. More trucks would allow for expansion of pickup and delivery services. And debt retirement, primarily the mortgage, would allow for additional expansion of services across the region and country. Recognizing that supporting the mobility impaired is only helping a portion of the larger disabled community, we're looking to expand our services to include other assistive technology related to hearing, speech, and vision. Voice recognition software, augmentative speech, mounting hardware, and low vision readers can provide wraparound services for clients with multiple disabilities. This would allow them to engage more fully in the community and lead more independent lives. We also want to bring our services to our clients rather than requiring them to come to us, expanding our reach deeper into the disabled community.